Hey guys, if I don't look too swift, it's because I don't feel too swift. I currently have an ear infection in my left ear, otitis externa, colloquially known as swimmer's ear, which that's kind of a misnomer because, it's usually found in people who swim and do get water in their ear and the water is gross. But it can also happen just because you introduce bacteria in your ear by accident. Maybe you scratch it with a fingernail, which that's how I'm pretty sure I caught it. And it's quite the story, and I've had quite the morning. And good God, I've got Gucci and Dolce & Gabbana under my eyes here. These under eye bags are packed to go. Good grief. So right before Christmas, I was grocery shopping with my mom, and I had my ear defenders on, and I got a really bad itch in my left ear. And I had just touched the handle of the grocery cart, but it was just a reflex to reach under, lift up the ear defender thing, and just kind of just give it a little scritch with my fingernail, just an upward outward motion, relieve the itch. And then I realized what I'd done. I'm like, crap, I hope I don't get an infection. December 26th, the day after Christmas, I get in the shower, and sometimes water gets in my ears despite my best efforts. I mean, that's part of taking a shower for me. It doesn't always happen, but that time it happened to get into my left ear, because I fold my ear down like this on both sides as I'm rinsing my hair, so the water will usually kind of just cascade over and not go in. But I lost my grip and it slipped like that, and the water went straight down into my ear. Not full power, it kind of just dribbled down, but it went into my ear canal, and it created that gurgly, nasty feeling that just, ugh. And it was instant pain. Like, I saw white. And I cried to my mom about it after the shower, and I put alcohol in my ear, because that's what I did as a kid when I got water in my ears, is put alcohol in it to dry it out real quick so that you don't get an earache. So I did that, and then I told my mom, wow, my ear really hurts, and she told me to go take some Tylenol and ibuprofen and just see how it was. But the next day, my dad had to go to the doctor, so my ear was hurting really bad on the 27th, but I didn't say anything. I just kept taking pain meds, and by the 28th, there wasn't really that much pain. It was kind of receding and going away. And then by the weekend, it didn't really hurt. So, and I kept water out of my ears, so I figured, well, it doesn't hurt now. But then the next shower, on the following Tuesday, I shower twice a week, because if I shower anymore, I get bad dandruff and dry skin and itchy and all that, and it triggers my eczema. So I have eczema on my back. It's not fun. So whenever I'd get water in my ear, it would hurt really bad. And then it would calm down and stop, off and on, come and go. And then Friday night, I didn't get water a lot in my ear, but a little bit did, and it kind of hurt, but not like horribly. So I didn't think anything of it. I just kind of swished my ear, because I got it in both ears, but I swished this ear, and then I went to swish this one, and oh my God, it hurt so bad. And then it calmed down. When I took ibuprofen, it calmed down. But then I woke up Saturday morning, and it's like my ear was screaming. The pain was literally just radiating through the whole side of my face and the side of my head and down my shoulder. And I took Tylenol and ibuprofen, and that kind of calmed it down, but didn't really stop it. And I didn't say anything to my mom during the day, because I figured it would eventually just calm back down. But then that night, it didn't. It was still roaring and screaming and just so painful. So I told her, Mom, I think I need to go to a doctor. And she got mad because she had all kinds of stuff that she wanted to get done. And with my anxiety, I took her getting mad at me as being mad at me for being sick, basically, which that wasn't the case. But that's how my anxiety read it. So we kind of had a screaming match, me with my ear hurting, so I was not very logical. So today, we spent 3 hours sitting in urgent care waiting to be seen, and I took my little tiny Wile Coyote, not my Wiley that I keep here, it's a small one. I don't have him out, I put him away because I didn't want him to get lost. But I was having the urge to hit myself in the head, because I'm autistic, get it? And when I'm in pain, sometimes the self-injurious stims happen. So I was holding on to Wiley because if this hand was occupied, both of my hands were occupied holding him, I wouldn't be punching myself in the head. But every time I put him down, I would start to, my hands would start to go there, just by their own accord, and I wanted to go after my left ear because that's where the pain's coming from. So I managed to control myself, and the wait was so long. And then we get into the office, and of course my pulse is high because I have the white coat anxiety, where when I go to the doctor my pulse races because I'm autistic, and I know that exams are unpleasant, and I'm anticipating that unpleasantness. And they always comment on that, but I tell them it's white coat anxiety. My pulse doesn't race like this when I'm sitting home alone, calm at home. When I'm sitting watching YouTube, my pulse does not race. This is not my usual. My body does things it doesn't normally do when I go to a doctor. That's just how my body reacts, but my pulse is usually about half this number. So, so they didn't worry too much about my pulse and blood pressure, because usually they freak out about it. But when I explain that, they go, oh, white coat anxiety, we get it. And, they drop it. They don't push it on me. So, but I wrote down all of what was wrong because I knew I would struggle to speak, and I'm glad I did because I had a hard time communicating or talking through the pain. But they did a lavage on my ear, which, oh my god, I practically levitated off of the table, and I got really dizzy almost immediately. And usually when I get a lavage, I don't get that dizzy very quickly. But she used warm water, and at first it felt good, but then it started to hurt really bad just through my ear canal, because they saw wax and they were trying to get it out of the way so they could see my eardrum. And I guess they got the big piece out, but I couldn't take it anymore, so they had to stop. And my eardrum looks okay. So, but I told them, it's swimmer's ear, it's otitis externa. I don't think my eardrum is involved because my hearing is not affected. And usually when there's an eardrum problem, like the middle ear, when there's a middle ear infection, my hearing will be muffled, and my hearing is not changed at all. So the lady, she apologized, she was really nice, because there was the nurse, and then there was the nurse practitioner, I guess, I don't know. But waiting for the doctor person, let's just call him the doctor person, they did not have two hearts or a TARDIS, unfortunately. But, there was just such long waits in between when she would come in and look at me and check on me and stuff, and I'm on the table just rocking back and forth, holding on to my Wiley, and I start crying, and I'm 43 years old. I'm going to be 44 in July this year, 2024. And I was crying like a 2-year-old because I was in so much pain. If I'm vocalizing pain, if I'm complaining of pain, it's significant enough that it's warranting my attention. This was a 20 out of 10. I'm getting teary-eyed just talking about it, because just remembering the pain I was in sitting in that office, and it's like I started to get confused about where I was, but I'd look up and see the light, and I'm like, oh yeah, I'm at the doctor's office. But I was starting to kind of dissociate, but my body would pull me back with the pain, so it's like I couldn't even daydream myself out of it. I was just, whoops, knocked my iPad aside. I'm trying to get my tangle. But just, I think my mom was trying to not let me see her cry, watching me cry from being in pain. But, I saw her wiping her eyes and sniffling, and, because my mom's not a crier. She's more of a, kind of a sniffler type of a person. She's quiet about it. But the amount of pain I was in is just unreal. I mean, I'm getting my period at the same time, I mean, talk about crappy timing, right? Um, I wasn't even noticing the cramps. I felt a sensation of pressure, and I still just feel a sensation of pressure. But all my body's pain signals were going to my ear, regardless of what was hurting. It was all going to my ear. It was like the pain was just radiating to this one place. Ugh. So, sitting in that office, I was swearing. Like, I don't want to repeat what I was saying, but I was swearing from the pain. Not in front of like the nurse and the doctor, but like, just hurry the hell up. Where the F are they? Son of a B, this hurts so bad. God help me, please. Lord have mercy. Just praying to God and swearing at the same time. And then it was just, oh, ow, oh, mommy. That's kind of how I sounded, but with a bit more crying involved. But now I got home. I've got the Tylenol and ibuprofen in my system. I've got steroid anti-inflammatory eardrops and antibiotic eardrops, and I've got all that in my system now. So while I can feel that it's there, I don't feel like I want to crawl through the ceiling right now. At least, in a couple more hours when the oral pain meds wear off, it'll be a different story. But for right now, I'm comfortable. But man, that was a miserable morning. If you know an autistic person that's in pain, the best thing you can do is just let them moan and groan and feel it, because, get them pain relief immediately, but don't be like, shh, stop it. Don't do that, ever. Because we're already told to do that enough. So trying to silence us because we're in pain, we already have to live with that all the time anyway. When we're genuinely sick, just let us express it. That's all. But, Ow. Ow. Yeah, the pain, it'll flare up. Damn. That's what I was doing in the doctor's office. Yeah, it's flaring up. Talking is triggering it, so I'm gonna stop. But I have an ear infection, and it sucks. That's all.